Okay, so this is going to be trach care suctioning for your fourth semester competency. So I have come into the room. I already have my client in a mid-Fowler's position. They have an oxygen source of trach collar, and I have assembled my equipment. I've got my ambu bag, I've got a drape, I've got obviously my gown on, which is optional for clients. Make sure it's tied and secured in the back so it doesn't fall over. I've got my stethoscope so I can assess my client. I've got my mask. I've got my suction catheter kit. I have my sterile water here. I have my method to perform hand hygiene, and I've got my suction equipment and my non-sterile gloves. I also have a garbage can down low here, so I have everything within reach for me to do this competency with. So I come in and I've gathered my equipment. I'm going to explain the procedure to the client and make sure that I identify them. Now, because they have an artificial airway, that can be challenging, so I can check their armband against their medical record, electronic medical record device that I have, and I could also, if there was a family member in the room, have them confirm that I have the right client, or if the patient can communicate somehow, I could have them mouth their name to me. So, Ms. Jones, I'm Annette. I'm your nurse for today, and I noticed that I'm going to assess your lungs and see if you need trach suctioning. Now, to do that, I'm going to need to do a couple of things. I'm going to need to make sure I listen to my client's lungs. I would notice if there were any visible secretions coming out of the trach itself that would indicate, or if my client's O2 saturation level was dropping, that would be some indicators of my client needing suctioning. So I have an O2 sat monitor. I'm going to put that onto my client's finger, and I'm also going to make sure I establish some sort of communication with my client so that if they experience any kind of discomfort or distress, they can communicate that to me. So Ms. Jones, if at any point during the procedure you have some kind of distress and you need to communicate with me, just make sure you raise your arm. And can you do that for me? So at this point, she would raise her arm. So I've identified my client, I've explained the procedure to the client, I have the client in the correct position. Now I'm going to assess my client. So I'm going to listen to my client's lung sounds. I'm going to make sure that I get my stethoscope directly onto the skin and assess all lung fields. And I want to compare one lung side to the other. So in my assessment of the client, I noticed that she does need suctioning. So at that point I'm going to do this. I need to leave my stethoscope here around my neck so that after I suction, if the first time I'm unsuccessful in getting all the secretions out and they need suctioning again, I've got my stethoscope here and readily available. So I'll go ahead and place the drape over my client. Make sure that I check my O2 probe. Let me go ahead and put my mask on. Got that in place. I'm going to go ahead and check my suction equipment. Now, this is a portable suction, so for this, my suction settings on portable should be between 5 and 10. If it were a wall suction, then those settings are going to be between 120 to 150. But this is a portable suction, so in order to check the suction, I'm going to turn the machine on, and I have to occlude the end of the suction catheter to see what the maximum pressure is currently set at. I don't want to apply too much suction because that can cause trauma to my client. So I can occlude the end or I can pinch it off. So I'm going to turn the machine on. And when I occlude the end of this, I need to hold it there for a few seconds because, as you can see, by holding it there for a few seconds, my suction is currently set at 20, which I know is way too high. So at this point, while this is still occluded, I would adjust my settings to be between 5 and 10. Then I can let it go, and I know that that's the maximum suction that will be applied when I put the catheter down into my client's trach. I could also pinch the tubing and do the exact same thing. But again, when you pinch it, you have to hold it there for a minute to see what the actual maximum pressure is that's going to be applied. So I know my suction is working. I know that my pressures are set at the correct amount. So for right now, I'm just going to turn this off and have this readily available. Now as I go here, I'm going to make sure that I perform hand hygiene. And keeping a check on my client's O2 sat. And of course they got their trach collar. I'm going to open up my suction equipment. Okay, now when I open up this suction equipment, I notice that there is the box that is going to contain my sterile water. That needs to be kept sterile, but there are parts of it that I can touch. So I'm going to grab the box here, and it has a clear plastic lining on one side. That's where the water is going to go in. So I squeeze it and open that up. And again, I don't want to touch anything inside of there because that's what's sterile. I'm going to set this here. Now I'm going to open my sterile water. This has been opened before, so I want to check for clarity. I want to check the expiration date on it. And because it's been opened, I need to make sure that I lip it. I'm going to open this. If I set the cap down, I need to make sure that I set the cap up so it doesn't become contaminated on this liquid. I'm going to lip into my garbage, because the purpose of lipping cleanses any debris that's there. And I will come and pour the solution in my box. And the weight of the water should allow that plastic to collapse down. And then I'm finished with this. Now I am going to open up my package, and in this package are my sterile gloves and the suction catheter. So this has my sterile gloves right here on the top. Now, this is now all sterile inside of here, and there are some principles that you learned about a sterile field. That everything is sterile until you open it up, and then once it's opened up, that 1-inch border we consider to be contaminated. I'm going to make sure that that kind of stays open. Sometimes I have to manipulate. Okay, my first sterile glove. When you put on sterile gloves, if you remember, you touch the inside of that first glove, and I'm going to put it on, making sure that I only touch the inside, and I make sure I get that glove on completely. I'm going to make sure it kind of comes over my gown a little bit. But this back part of this glove now is contaminated because I have touched it, or any part that the gown touches on my glove becomes contaminated. I'll just scoop that up. Now, this hand is sterile. I can touch this because this hand is not sterile, but I can grab anywhere on this glove that I want to because I'm touching sterile against sterile. So with the second glove, I'm going to grab up under the cuff part there and identify where my thumb is, which is right there. And y'all know how to put on sterile gloves. You put them on since first semester, so this should not be a challenge for you. Protecting my other gloved hand and putting on my second sterile glove. Now, remember, this is sterile. Grab my suction catheter and come out with it. Remember the principles of sterile technique. Try to keep everything above the level of the waist. Sterile touching sterile. All of this is sterile. I'm going to kind of wrap this in my hand just because it's a loose, flexible catheter. And at this point, I'm going to connect my suction catheter to my suction tubing. So in this process, one hand is going to become contaminated. For me, that's going to be my left hand because I'm right hand dominant. So I'm going to grab the suction catheter. Remember, all of this is sterile right now because it's in this sterile hand. But this is not sterile. So when I connect these two together, the black part of this tubing is going to become contaminated because it's touching something that is contaminated. But I want to make sure I don't contaminate my right hand. Connecting that together. And if you'll notice, on this suction catheter, there is an opening. That controls my suction. That's what I'm going to use now to control my suction. I have to test and make sure that everything is going to go through. So I'm going to come here and turn on my suction, and I'm going to test it by putting it in the water. Remember, my left hand is not sterile. Right hand and everything up until this point is sterile, and I want it to stay that way. Now, I'm going to come to my water and occlude the end and allow some water to flow through the catheter. That ensures that it's clean, it's clear, and it's ready for me to suction my client with. Now, my client has oxygen, and in your guidelines it says that we should hyperoxygenate the client with a trach collar for 30 seconds. I've been doing that for more than 30 seconds. So now I can remove the oxygen source. I'm going to unhook that. Remember, this hand is not sterile and it can only touch from the black part down. I'm going to insert the catheter into the client's trach 4 to 6 inches until I meet resistance or the client coughs. So I insert the catheter 4 to 6 inches, making sure I don't contaminate anything until I meet resistance or the client coughs. When that occurs, I'm going to occlude this port and suction intermittently no longer than 15 seconds on the way out. And when I do that, I'm getting secretions out. I'm going to come real quick here and clear my suction catheter. Now, I'm going to reassess my client because there's the chance that they may need suctioning again. But remember, my right hand is sterile. My left hand is not. I want to keep this sterile in case I have to go back and resuction. So I'm going to hold that. This is sterile. But now I've got to assess my client with this non-sterile hand. So that's why I left my stethoscope right here. So I can put it on my ears. I'm looking at my client's O2 sat monitor, and I need to listen to their lung sounds again and keep this sterile. So I reassess my client. And let's say at this point they need suctioning again. I would simply, because this is clean, go back down into the trach again, just like I did prior. Suction intermittently on the way out, and I would reassess my client again. At this point, we'll say that my client's lung sounds are now clear. I want to immediately put the oxygen source back on. And you know what? I should have probably turned off my suction while I was auscultating my client's lungs because I could probably hear them better. So if it doesn't interfere with your ability to hear the client's lung sounds, feel free to leave your suction going, but just keep in mind that you may want to turn that off so you can hear your client's lung sounds really well. So now my client's lung sounds are clear. I want to make sure that the sterile part is over, so I can make sure that this is cleared out of any secretions, because you don't want any dried up secretions getting in your suction catheter and getting all clogged up for the next time that you need to use it. Disconnect that, unhook this. Constantly assessing my client, looking at their color, their respiratory rate, their oxygen saturation, making sure everything is fine. And then I'm going to clean up my supplies. I want to gather up my suction catheter in one hand and keep it there. I want to take my gloves off. All that nice and neat right there in my gloves, and I can just throw all of this away. And clean up my supplies, assess my client. So I've got my gloves away. Now to take my mask off, I need to make sure that I have all clean gloves. my mask, throw that away, put all of my supplies up, take my gown off. And go and document my procedure. Take my gloves off and perform hand hygiene before I leave my client's room.